well-being, our happiness, is achieved through being actively listening and being part of our community. Part of that might be being involved in, for example, becoming involved in the community. Alma's here as a councillor for this ward. It's a particularly intense and close-knit community. So it's great if as many people as possible can become active in that, can become helpers, can become part of the community in that way. Is there anything you want to ask, or any issues around becoming political, becoming active? I'm going to have to leave, as I said. Speak to Alma, she'll be able to help you, or get in touch, in our case, through the party. We so want as many diverse groups as possible to be involved, to help each other to move forward. Thank you.
Thank you very much once again. Can we give her a round of applause again, please? Without wasting much of our time, we'd like to invite our first speaker. He's going to also be talking about challenges BAME community are also facing.
I think it's a very important point. The work that we have done is about reviewing government policy, and obviously you will know that we are officers and we kind of implement policy as it is directed to us. It doesn't mean that we agree with the policy. And I'm sure Rachel will talk about some of the findings when we did a survey around in terms of is this really going to bring in the resources that are consummate with the level of work that goes in. I think there is a big fallacy around health tourism. Don't get me wrong, in other areas such as in London, health tourism is a big thing, but up here in the Northeast, it's not as big a thing. But I suppose, given that this is a meeting that's been facilitated from a political point of view, we perhaps are restricted as officers in terms of how much we can go into the politics behind the policy. But what we can flag with you is what we are seeing on the ground and the implications of that policy. And maybe that's up to the party to start looking at, so what does that mean in terms of challenging that policy or lobbying for those groups who are disproportionately being affected. I think your second question really highlights some of the ethical dilemma that doctors have. Exactly. Exactly. Yeah. Yeah. So when you speak to our colleagues in hospitals who are clinicians, they will tell you that the reason why they went into medicine is to alleviate suffering and help people at the point of need. The NHS constitution talks about access to NHS services should be based on clinical need and not on the ability to pay. So there is a whole range of ethical dilemmas. If you are a clinician and you're faced with someone who you know that through your intervention you can relieve their symptoms, you are either left to make an immigration decision to turn them away, or to treat them out of your compassion and then have your overseas manager saying to you, you shouldn't have treated them. So it presents lots of dilemmas. The other dilemma that it presents is it then potentially means that you say to an individual, well, you're not eligible because your needs are not classified as urgent. So basically go home, get worse, come in blue-lighted in an ambulance, and then you're urgent, and then we'll treat you. Now, what does that mean in terms of the dignity of the individual, in terms of outcomes, but also from an economic point of view? We know that the interventions that we deliver for people who are blue-lighted into hospital are a lot more expensive than what we deliver for people who walk into the hospital. So some of this is kind of built on a false economy, which says that actually by turning these people away, that will make a saving. Actually, if those people go away and they become worse, then they become eligible, and we then have to pay even more.
this is the reason why we think it is necessary for us to be coming around like this time of the day to kind of have a discussion around these policies, around these services, to see how we could improve the services and even some commitments for every sector. I know Ben Smith will know that maybe this might be one of the challenges people are having to access or to even be part of this NHS mental health services, because they might be afraid whether they need to pay or they don't have to pay, or they are eligible to do that. Hopefully, we've got some local councillors who are part of the decision makers, and I think all of these things has to be fed into your policy, into your manifesto, to see how we could really change, because we don't want willingness. We want people that will commit to do things that people want for fair system. I would like to recognize one person here. He joined us while the program was going on. He has been recently selected as a candidate for May 2019 election. Hopefully, we'll start having our faces in the policy decision makers. It's no other person than John Kabui from BAME community. Do you want to just wave a hand and let people see you? Yeah. Thank you for coming around. We really appreciate you. These are the things we're trying to see to improve the diversity and inclusion, and to see, because if people don't feel it, they don't know what it's all about. If people of their role model are not part of the decision process, they will be able to see challenges, or from cultural background, like you've mentioned, it could be cultural awareness or something like that. That will lead us to the next speaker, because I will have asked Ben Smith to add it in his presentation, the workforce representation of BAME community and the breakdown, but unfortunately we don't have that in your presentation anyway. I would like to invite the next speaker.
The provision. I understand that we might not want health tourism. I understand that we don't want exploitation of the services. But I'm heartbroken that the rules and regulations that have been put in are not taking good care and cognizance of the needs of the most vulnerable people in our society. And I think that's where we have our dilemma, ethically and morally. What we can do in the meanwhile, as people have said, is strive to support people around us, race, nationality, creed, who need our support with their mental ill health issues. But the bigger picture of care, professional care, is still of great concern and great worry to me, and to many others who believe like me that we have a duty of care to everyone who needs it, and that access, and even at later stages, to give people a bill when they have no money. I can't tell you, I haven't got the words to say how despicable that is. And to put people into debt who aren't going to be able to pay the debt, to give them more and more mental health crisis, to me is criminal and shows a total lack of compassion and understanding. I don't want to end on that sad note, because I think we need to keep trying in a positive way to do all we can. And as Ola mentioned, we need to lobby, we need to vote, we need to campaign, we need to get things changed, and we need to get things improved. So as a local councillor, a member of the Labour Party and an activist and a campaigner, that's what I'll be striving to do. Anyone who can help us in the quest is very welcome to join us and to support the cause. Thank you very much.
Very impressed with what the Labour's leaders say. We have a right to offer the health duty to the people. Because I have a Chinese friend ask me a question. She had been stopped in the airport. She have to pay £3,000 before she can get in this country, because she have a child here in the NHS. And then they say she didn't pay the bill, but the communication not very well. So when she had been stopped by the immigration people there, while her husband was running around, to get that £3,000. So I think all you have to put the policy very strictly. Now you just tell us in the small group, people say, oh, you need to pay this, you need to pay. But if they want to be clear, they need to be louder, tell educated people first, let the people have a preparation for the fee they need to pay. Then I think there's a good old day since gone, you don't need to pay any fee. Maybe in the future will be a little bit like China, some pregnant woman taken to the hospital, and then doctor said the money first. So that later on the people die, you know, the pregnant woman die, and then her husband start to get the gun to shoot everyone, you know, to cause the society quality. So I think the Labour's policy is still very encouraging. We need to think how to reduce the budget inside to offer the better health to the people. This is what I think is the best way. Thank you.
To say that, and one of the things we're
doing public health, because as Edward explained, we're not the ones that are implementing the policy, but we're trying to mitigate around any negative effects of that, is to raise our awareness. So for instance, the research we produced is to let people know about what the rules are so that they don't fall foul of that and how they can access healthcare. But then just to label the point around pregnancy, no woman should be prevented from accessing healthcare. No one is going to ask her for money up front. She should be able to access healthcare, and that shouldn't be a deterrent because of what the rules say around the fact that it's classed as urgent and necessary. It doesn't matter what stage in her pregnancy, she should be able to access healthcare.
And, the reason why we're interested in this is a real public health issue. That if you've got people who don't understand their entitlement to health services, it means that some of them might not access services even when they were entitled to. Because it's very, very confusing. Now, try and think about it in terms of our communities. When you've got all the other issues that you're worrying about, we know that in these communities, it is mainly word of mouth rather than the official figures. So we know in these communities, if one person has a bad experience, the whole community kind of lives that same experience. So our concern is that there will be individuals who will not access treatment because they know of a friend who was charged, and they then transfer that experience onto themselves. And the risk of that is we will start to see people living with conditions that could have been prevented. But sadly, we could start to see people actually dying out of things that could have been managed more effectively. So we feel for us, from a public health point of view, this is a health inequalities issue, that this is a social injustice issue, and actually the authorities implementing these policies need to be out there and making it very clear so that at the very least, people understand what the policy stands for, and that people don't end up staying at home and not accessing services when they were entitled to.
Yes, sir. So as a trust, that's what we're trying to do, to be more inclusive and have trauma-informed care for everyone.
There's a broader issue with regards to the configuration of public services and how reflective are those services of the changes in the population. Look at the census data for Stockton. So the census in 2001 showed that the BME populations in Middlesbrough was 6.8%, and Stockton was about 2.8% of the entire population. The next census after that, which was in 2011, BME population in Middlesbrough was almost 12%. And in Stockton was almost 6%. So in a period of 10 years, you have got BME populations that have doubled. Now, I think there is a legitimate question that we need to be asking ourselves as public sector organizations to say the model of service delivery across a whole range of services. It's not just health, it's not just about supporting victims of torture and trauma, but what is the model that we are commissioning our services or delivering our services based on? Is it based on what we've always done? Or actually, have we taken stock of the population changes to start reflecting that in the service offer? Because we might find that our services are 10 years behind, and that actually the things that people are presenting with, our services aren't prepared to be dealing with that. One of the things that we probably need to start thinking about is if the rate of increase has been a doubling in every 10 years. The next census since 2011 is going to be in 2021. So what does that mean in terms of BME populations? Are we now almost 20%? And you just have to walk around Middlesbrough and in Stockton to see that the town is changing. So how are we planning our services to start thinking ourselves as a multi-ethnic city or multi-ethnic town, and is that reflected in our offer? And that needs a discussion with health services, it needs a discussion with education providers, it needs a whole discussion to say, can we start preparing ourselves for what the town might be in 10 years' time? So that we're not caught unaware, but that actually we're sitting down and saying, right, well, given these trends, if in 10 years' time we've got more people from these community groups, what are their issues? One of the issues which we have now seen, and I think Idris can talk a lot more about that, is a specific service for caring for adults and older people with dementia in the Asian community. That's because we're now into third or fourth generation in some of the times, and those individuals now who first came in here as productive workers are now in their retirement ages. And they've got needs that are related to their religion, to their beliefs, to their cultural upbringing, that a bog standard adult social care service might not be able to provide. So we need to start having those debates now. Otherwise, if we don't have forums for having those discussions, what we will find is that we are in a situation where we're always playing catch-up. And then for those population groups, the services that we have will not deliver and will not improve their outcomes.
In order to make a case or a campaign, we do need to collect evidence of people and specific cases and make sure that we're all aware of how many cases, where they are, what the issues are. Picking up on what you said, Edward, I think it's confusing for people exactly what they're entitled to, etc. And therefore, as you said again, they probably won't know if they'll access the services or not. Maybe they'll get very ill and maybe whatever. And we won't have those in our statistics because they've fallen through the net. So that is really disappointing that there'll be a lot of cases that we can't track as evidence because they haven't even accessed the services through confusion. However, I think it's really important if we do find cases that we recognise, that you know about, that we do compile a list of cases as evidence, which we can take forward to other groups, to other forums, to the Home Office, or to pay attention to this. So I would make a plea to everyone, if you do know of cases which could be part of the evidence that we need to collect to make a strong case to campaign or lobby on, we need these figures, we need these stories, like you've just mentioned, and other stories that would support the case of people not being able to access the service because of a payment issue. We definitely need all of us to try and compile this case study, to put it forward as a campaign issue to try and change policies where necessary.
If you let people know from cultural background, they tend to understand, and they kind of seeing how they could also even incorporate this into the services, into the training of the staff, employee, you know. So if you could put this down, if you have any concern, I would like to say thank you very much. We started this Building Bridges, Breaking Barrier project in February. We started with barriers to inclusion in decision making, whereby we have people from council, Middlesbrough, and from there we moved to importance of women in politics, because we want women to get involved in leadership, so that they kind of influence what's strictly meant for women and our young girls and the children at large. From there we do other one, which is question time with local police. We'll kind of try to understand and build that bridges with the police in the community. We did one also. What did we do last? Okay, be a community champion. We did be a community champion, kind of encourage people to volunteer, because if you don't volunteer, you will not even have access to understand what it's all about, and if you are not really a staff, but people could know what services are available through awareness creation. And we are here today, we talk about mental health issues. Before mental health, we did one last, what we did? Okay, employment. Yeah, we did employment and discrimination in the workplace. So these are the challenges we have in the community. If there's any other thing you think you want us to do in the future event, do not hesitate to email us, either of the email. Hopefully, we're looking at December to kind of have a social network event, kind of come together in a relaxed mode to kind of see how far we've gone, where we need to go, and how do we want to begin the new year 2019. And through that, we could continue to have a kind of a fairer environment. That's what we're about. That's what we're passionate about, to promote inclusion and diversity in the community. Very much. Keep in touch with us. Follow us on Twitter, Instagram, YouTube, to know more about even previous events we've done. So if there's anything you could like to contribute, let us know.
To really understand the issues that you have talked about and whether there's more that we can do, because we absolutely believe it's the right thing to do, to have a specialist practice that caters for a community that, if dispersed across all the other practices, will get a service that is not as great as that. So maybe outside of here, we can exchange notes on how we can progress that. The second issue, which is around the mental health issues for children, I'm glad that you're plugged into the research that is happening. We have a concern in public health that when you look at the preventative services, our communities are not as represented. So we've got a number of programs that are earmarked for mental health and emotional well-being for children and young people. When we look at the data that comes through, for some reason, BME communities aren't represented. But I'm sure when we speak to colleagues within crisis services, there's disproportionate representation. So there is something we need to do about our communities understanding prevention and engaging with some of those preventative services. Now, with mental health, I know, because I'm from Zimbabwe, same as Beauty, that in my community, we only have 2 words for mental health. It's either you're fine or you're mad. And that is my literal translation of the word that we use. There's nothing in between. So when we approach those communities and we start talking about mental health, and you start trying to engage with someone, there is already the stigma that is associated with that. You can't have mental health issues and still function. That's how those communities categorize that. So we really need to do more work to engage with those communities to understand the whole emotional well-being, and then support them to get access into the preventative services, which we know can deliver better outcomes, and actually things can be caught much early, rather than when they then turn up as a crisis, where we then try to invoke much more complex services that don't always improve the outcomes.
Thank you very much. Hopefully, we will get there. In September 2017, I was elected as the BAME officer for Middlesbrough, and one of the work I first did was to consult the local services authorities, establishments, individual grassroots, and I realized what you just mentioned, that there's a huge lack of representation, within the community. That was why we said we have to do something about that. And through that, I could realize what we are facing in Middlesbrough is also the same thing facing in other neighboring cities, like Stockton, like Redcar, Tipo. So that was why we said, I can't do it alone, than to come together as Tees Valley, where we have like 5 boroughs now. And that one was successfully launched last month. And with that now, we are already planning now to make it a north-wide region representation. So hopefully in 2-3 months' time now, what we'll be hearing is Labour North BME Forum. This is what belongs to us. We are part of the system, and we also must be treated fairly in the system.